Both the Turkish pharma and medical device industries are heavily regulated and mostly in line with EU regulations. Even though the advertisement to the public for pharmaceuticals and some medical devices is prohibited, interactions of pharma and medical device companies with healthcare professionals are allowed and regulated with separate legislations. My name is Dicle Doğan. I am a managing associate at Günplus Partners, and I've been part of the life sciences practice area for 10 years. Turkish Medicines and Medical Devices Agency under the Ministry of Health is responsible for regulating promotions for pharmaceuticals and medical devices. According to the agency's regulations, promotion to healthcare professionals occurs through distributing promotional materials, visiting healthcare professionals, sponsoring or organizing scientific meetings and product promotion meetings. Within the scope of measures taken on COVID-19 pandemic, in March 2020, the agency announced that sales representatives shall not visit healthcare professionals and shall carry their promotional activities electronically. As electronic communication increased, the industry needed new guidelines for the organization of electronic scientific meetings. This led the agency to amend and publish new guidelines specifically for electronic meetings sponsored or organized by pharma and medical device companies. Companies may enter into written agreements with healthcare professionals to get consultation services. The agency does not regulate the conditions of such agreements. These are usually set by industry standards. However, companies shall take into consideration whether the physician works in a public healthcare institution to determine where the payment shall be made. Pharma or medical device companies can donate to public healthcare institutions or organizations and non-profit healthcare associations. For such, the donation must not lead to any unethical transaction associated with any purchase of products or encourage prescribing a specific product. The intention of the donation must always be for research, education, health or patient care improvement. Marketing authorization holders in Turkish pharmaceutical industry shall notify the agency of any value transfer made to healthcare professionals or healthcare organizations exceeding the VAT-inclusive monetary equivalent of 10% of the monthly gross minimum wage. Such notification shall be done within the first 6 months of each year for value transfers made the previous year. To fulfill this obligation, pharma companies must get the consent of healthcare professionals or organizations before any value transfer taking place. There is no public disclosure rule for value transfers made by pharmaceutical companies. Medical device regulations do not include any notification rule considering transfer of value. You can find more information on this topic in our website. Thank you for listening to me.